Good afternoon, everyone, and welcome to this virtual media availability. At this time, I'd like to turn the microphone over to Health Director Gibby Harris. Gibby. Unmute Gibby, please.
Sorry. Good afternoon, everyone. Thank you for being on the call this afternoon. I have with me Dr. Raynard Washington from the Health Department, as well as Dr. Rick Tankersley from UNC-Charlotte. And we are here to talk about the recognized case of the Omicron variant in an individual in Mecklenburg County. That individual is a student at the university, and the actual recognition of the variant in that particular case was identified through the sequencing program at UNC-Charlotte. So I'm going to turn it over for a minute to Dr. Tankersley to talk a little bit about where they are with this situation, and then we'll open it up for questions.
Thank you, Gibby, and good afternoon, everyone. I just maybe give you a brief summary of what we know about this particular case. So this is one of our students who lives on campus who traveled over the Thanksgiving break and contracted COVID during that time. When they returned to campus, they were symptomatic and were tested through our COVID testing lab here on campus. Based upon the results of that test, we also as we do with all our positive samples on campus, and also as part of our collaboration and partnership with the county, is we sequenced that positive case and received the results this morning that in fact it did identify as the Omicron variant. So as I said, this particular student was symptomatic during that time, was isolated following their positive PCR test, and has since recovered from COVID and is no longer in isolation. So they also, any close contacts that we identified were contacted through our contact tracing team and tested, and none of those close contacts turned out to be positive. So there's no indication based upon the information we have that has been any transmission from this particular student to anyone else on campus or anyone else in the community.
Thank you. The one thing that I want to emphasize here is that number one, the fact that we do have some sequencing that's happening in the community is beneficial to us and helps us understand the different variants that are impacting our community. And Delta obviously continues to be the main issue for us here in Mecklenburg County. But the other thing that I want to point out is the systems that we have in place in Mecklenburg County, the work that's been done, the collaborations that happen on a daily basis are really play out nicely in this situation where the student was recognized quickly with symptoms, was tested, was isolated, contacts were found, and so it's happened exactly the way we need it to happen to prevent further spread in our community. So I want to thank UNC-Charlotte for their work on this, but also for the partnership and working with us through these situations. I'm going to ask Dr. Washington if there's anything he'd like to add to this before we open it up to questions.
Nope, I would just say I think this is just another reminder for our community why it's important for folks to continue to do those things we've been encouraging all along. Of course, get vaccinated if you're eligible to get a booster, and go ahead and get that done as quickly as possible. And of course, when you're indoors in public settings, please wear a mask.
Thank you. So we'll open it up to questions now.
First question today is Brett Jensen, WBT Radio.
Hey guys, just curious, Dr. Washington, Gibby, Dr. Tankersley, I'm just curious, as you guys knew this was eventually going to happen here, in terms of the Omicron variant, what do you guys know about it? I saw a report the other day ago that like 15% of all the children in England are now developing rashes that contract the Omicron, but there might have also been reports that it's not quite as serious as Delta, the symptoms are less. So what do you guys specifically know about Omicron?
Probably not much more than you're reading, Brett, because it's evolving as you know. It's still a fairly new variant out there, and we're seeing how it's evolving in the different communities that is seeing large numbers of this variant. So we're watching it as closely as you are. The main point here, I think, is again for people to do what they need to do to protect themselves, and that hasn't changed. So we know we're going to see it in our community. We know now that it's here. I'd be surprised if it hadn't been here before, but we are watching closely what people are experiencing in other communities and other countries. And as we know more about it, we'll definitely make the community aware of those things.
Next question, Chloe Leshner, WCNC.
Thanks so much. Just wondering if there's any more you can share about this student, kind of what their symptoms were. Was it a severe case? Were they vaccinated? And then do you know where they traveled to? Was it out of North Carolina? Thank you.
So I can give you a bit more information. They were traveling outside the state. They were fully vaccinated as well. We do have that information. Their symptoms appear to be fairly mild based upon the report to us, and we're in the isolation facilities that we have here on campus recovering from those symptoms. And so there was no hospitalization associated with this particular case.
Next question, Derek Dellinger, Fox 46.
Thank you for taking my question. It's actually two quick questions here. As far as we know, is this the first case, just to be official here, is this the first case that we are aware of in North Carolina? And also, are you surprised that it's actually here in Mecklenburg County?
So in our conversations earlier with the state today, this is the first confirmed case in North Carolina. Obviously, the first confirmed case in Mecklenburg County. With the travel that we have in and out of our community, I'm not the least bit surprised that we don't have the first case that's documented, but I'd also be surprised if there's not other cases in our state that just have not been discovered at this point.
Next question, Will Wright, Charlotte Observer.
Hi, thank you all. I just wanted to get a bit more on the timeline about when was the student actually tested, and if they've since recovered and are now able to not be in isolation. It seems like it would have taken like 10 days to get this result back. Can you walk me through that and just how you do the sequencing for Omicron?
Sure, I can give you a bit more detail on the timeline. Testing was done when they returned to campus right after Thanksgiving, and through as I mentioned earlier, through our testing facility on campus. Based upon those results, all positive tests are then handed off to our sequencing team that combines those positive tests with others that we're collecting through a partnership with the county and StarMed to be able to monitor and survey the presence of different variants within the community. It takes much longer to process the sequencing data samples, mainly because there's not just the analysis has to be done through our sequencing unit, but also the actual once you've sequenced the variants of the virus, you have to then interpret those results. So it takes about 5 to 7 days for us to complete that process. And so I know it seems like it's been some time since that positive case was identified, but it takes a period of time for us to be able to process those samples effectively.
Next question, Diego Barahona.
Thank you. Escuela Noticia. We have right now around 20 states with Omicron cases confirmed in the US, and we are approaching to Christmas. So what would be your message for people that are planning to travel at this time?
Reynard, I'll let you handle that one.
Sure, yeah. So as the holidays are coming, I think I'll go back to my comments earlier. First and foremost, The first thing we all need to do is get vaccinated if you have yet to do that. If you're eligible to receive a booster, go ahead and get your booster and plenty of time ahead of the holidays. Encourage folks to continue to do those basic prevention measures that keep the spread of COVID and other viruses down. That includes the hand washing, if you're sick, please stay at home. And of course, if you are traveling to another state, another city, another town, you don't want to do so if you have any of those symptoms. You may consider getting tested before you travel, and certainly watching for symptoms if you're around other individuals. And when you get back home, also as well, continue to watch for any symptoms if you've been in indoor settings or around other folks or large crowds of people that you don't otherwise live with. But I think the most important point, I'll go back to where I started, is if you have yet to get vaccinated, please do get vaccinated. That is what we need folks to do to keep folks out of the hospital, keep people alive, and keep folks from having or experiencing severe illness.
And the only thing I'll add to that is that that's the case whether you're trying to avoid Delta or Omicron or any other variant that's out there right now.
Next question is from Chris at WRAL.
Hello, can you hear me? Is my mic working?
Yes.
Okay, just double checking there. Sorry, two people already asked questions that I had. I guess I'll just ask. I know you said you expect this to kind of be the case with as many people traveling through there. I mean, going forward, what should people know about Omicron? I mean, if we keep seeing variants of different variants of COVID that pop up here and there, I mean, you know, I mean, what do they do at this point? Some people are, I guess, are kind of waiting to see like, oh, is the country going to shut down again, or do we just kind of wait to see what happens because it's still relatively unknown?
That's a great question. And a lot of it depends on what we're seeing in our communities, in our state and across the country as well. The reality is we're moving into the winter months. It's colder and our viruses like colder weather. And we're also looking at another set of holidays that we're moving into as well. We're hoping that we will not see any big spikes in numbers, that we'll be able to sort of maintain. If we see increases, that they're small, but we anticipate potentially seeing some increases over this period of time. And that just reemphasizes the need, as Dr. Washington mentioned, for people to get vaccinated, to get boosted, and to wear their masks indoors and to protect themselves and to protect others. You know, this virus is not going away. It is not going away. That's probably the one thing that we can pretty much say for certain. What it does, how it mutates, and how we manage it are the variables that we have to deal with. And so the one thing that we have control over is how we deal with it. And that goes back again to getting vaccinated, wearing your mask, and avoiding large crowds. So those are the things that we can do to keep this under control. And that's what we're asking our community to do.
Next question, Brett Jensen, WBT Radio.
Gibby, you just touched on something that I wanted to talk about. It's almost exactly 1 year ago, December 14th, when Dr. Passeretti became the first person in North Carolina to become vaccinated. And it was almost as this time last year when we started seeing that really, really, really big spike. And it's really the only time we've had a spike where like hospitals started getting overrun in early January. So you said I just want to clarify, you're not that concerned about that happening like what we saw last year. And also, just for lack of a better term, a PSA, did the vaccine with that student from UNCC do exactly what it's supposed to do? Maybe not prevent you from getting it, but lessen all the symptoms?
Yeah, so for the first question, Brett, we are hoping not to see any spikes and any negative impact on our hospital systems. We do know that, you know, over the past month and a half, our hospitalizations have continued to rise slowly, very slowly, and that we're seeing more spread and more transmission in our community. So, you know, that's to be anticipated in the wintertime with viruses. So we're hoping that this will be a slow increase and a decrease again, as we've seen in the past. But there's no way to predict. So the more people vaccinated, the less likely that's what we're going to see. In terms of whether the vaccine did what we wanted it to, absolutely. You know, this person was fully vaccinated, had minor symptoms. Of course, they're younger, and our younger population is healthier and tends to have minor symptoms anyway. But I would think the vaccine has helped, and they've recovered, and we're grateful for that as well. So the importance is these vaccines aren't necessarily going to prevent people from becoming infected. We continue to see breakthrough cases. We know that we're going to see that, but it has decreased the number of people that we're seeing requiring hospitalization, serious illness, death, the things that we don't want to see in our community. So vaccines are critically important.
Next question, Derek Dellinger.
Is within the same vein of Brett's question, actually. How much do you think this is going to be complicating getting the positivity rate in the county back to where it needs to be for the mask mandate to go up?
Yeah, that. And the answer that everybody wants, and all we can do is watch what it does. Ours has slowly crept up over the last, like I said, month and a half. It bounces around a little bit. It's obviously not where it was back in August and September, which is good news. And we're hoping that it doesn't go up there again. But you know, the reality is, if we want to get those numbers down, and if we want to see improvements in our situation in the county, you know, the vaccines are the answer, guys. And wearing that mask is going to help as well. I know it's not necessarily what people want to hear, but that's where we are at this point in time, and that's what we're continuing to encourage.
Next question, Alexandra Elich at WCCB.
Hey everyone, thank you for taking my question. I'm sure, as you know, many companies, corporations plan on returning to work sometime in January or returning to the office. Would your recommendation to those companies maybe be to hold off? Do you still encourage remote work, remote learning, remote whatever? Is that something that should be the focus for folks right now instead of in person, given this new variant?
Oh, I'm sorry. Gibby, you waiting on me?
I'm looking at you on the screen. I don't know if you probably can't tell that, but I'm looking at you.
Sorry. Alexandra, I think, you know, our guidance to, I'll go back to Gibby's comment earlier. COVID is here with us. It is not going anywhere for sure. We will continue to see seasonal, and we'll continue to see sort of peaks and valleys as it relates to our key indicators. Cases will go up and down. We'll have surges. We don't know fully what that pattern will look like on an annual basis, but certainly I think, as Gibby mentioned earlier, it's here, and we have got to learn to live with it. And certainly we have the tools in our toolbox to be able to live with it, to protect life and to keep our hospitals from being overrun, and to certainly make sure that the impact of the virus on our community is not stopping everyday life. And so at this time, you know, I wouldn't have any recommendation. I think any employer, any organization that is having gatherings or doing anything in person, again, has those tools that is in its toolbox to be able to help make sure that they're mitigating and lowering the risk of transmission in the workplace. And there are a lot of policies, a lot of roadmaps in place for employers how to do so safely. And so we encourage folks to take it seriously, to be thoughtful, and to give us a call if they have questions about how to do so safely and what those specific tools are. Of course, vaccination is important, but as well as, you know, testing programs and all other measures that we've talked about that employers are implementing to make sure that we're lowering the risk of transmission happening in the workplace.
Next question, Chloe Leshner, WCNC.
Thank you. Just wondering, is this kind of like the tip of the iceberg? Should we expect to hear that more and more cases of Omicron are being sequenced in the lab here?
That's a good question. I would assume that we are going to see more. I mean, I think that's just a given, considering how we're seeing it spread in other countries. So
And I would just add to that, Gary,
Yeah.
we've scaled up our sequencing in anticipation of the possibility of seeing more Omicron in the area. Most of what we've been seeing for the last several months has been the Delta variant. And so in anticipation of Omicron coming to this region, we've already begun scaling up our sequencing efforts to make sure that we're able to track its progression and its prevalence within the area.
And I guess most of you have probably seen the comments from Dr. Fauci, who believes that Delta is still going to be the main issue for us this winter, even with the potential increase of the Omicron in this country. So, you know, Delta isn't going away, I don't think.
Brett Jensen, you're up.
Yeah, Dr. Tankersley, can you walk me through how UNC-Charlotte handles this? So especially since Omicron is such a new variant, the first one in the state, do you guys send out an email to the entire student body? Do you do that with Delta? Do you just do it to the dorm room? How do you guys handle that when something like this happens?
So in this case, we've sent out a notification to the entire campus, all of our students, letting them know that essentially a summary of the information that I provided you earlier, that talks a little bit about the case, what we know about it, the fact that the student has recovered from their symptoms, and that we have no indication of any spread. And there's been no samples that we received this week that give us any indication that we have other cases of Omicron on campus. I'll note that we have a very extensive surveillance and testing system, as many of you know, that includes our wastewater surveillance that samples our residence halls 3 times a week. We also look at campus neighborhoods to be able to detect the presence of the virus and map that against our, the prevalence here in the county. And so it gives us a bit of an early warning system to also test. We test all unvaccinated students weekly. We also have our own COVID lab on campus and our contact tracing team that works closely with the county. And so it enables us to move very quickly, not just to be able to identify cases, but to also, in this case, to sequence all of our positives and those in the county and be able to track this effectively. So I think we're pretty comfortable with the kind of layered approach that we've put in place to be able to not just identify these cases, but alert folks on campus when we do find something that may be out of the ordinary.
Well, just a quick follow-up. Do you guys also do that? Did you guys also do that for the Delta or just for this?
We did, and we tracked the prevalence of the Delta variant. We saw it show up. Obviously, shared that information with the county and worked with between our team and Gibby's team to make sure that they were aware of the prevalence. And as I said, in the last several weeks, we've been dominated largely by the Delta variant. So this was new.
Next up is Will Wright, Charlotte Observer.
Hey, this question might be too technical, but I'm just curious, is it fairly easy to identify Omicron versus Delta in sequencing? How do you tell the difference?
So it is. It has a very different lineage and has a signature set of mutations that are different than what you see in Delta. So you may have heard that as Delta has continued to spread, it is also, there have been a variety of different variants of that variant, so different flavors, if you will, of Delta. Omicron is very different, has a very different set of signature mutations that make it easier for us to be able to differentiate it from the Delta versions of the variants, or Delta version of the virus.
Gibby, I'm curious, in terms of, or maybe Dr. Washington, I'm curious, when it comes to like this testing, does that automatically happen? Do you automatically test for Delta and regular COVID and the Omicron? Or like, is that all in one test, or do you have to test for each one specifically? How does that happen?
Brent, I think we talked about this before, but definitely we're sending.
Sorry, Dr. Washington, I'm sorry.
No, it's okay. No worries. And I have to echo, the work that's happening at UNC-Charlotte really is a model for universities and other campuses. They have a phenomenal program, and the early detection system with the wastewater and the on-campus testing and sequencing really is quite impressive, and we are fortunate to have them as partners here in our community. As we alluded to earlier, we have several months ago, we set up a partnership with them and StarMed Healthcare to allow us to take a certain subset of samples, a random sample of positive samples from the community, which are then sent over to UNC-Charlotte's lab and sequenced. And again, it's not all the samples, it's a random sample, so we can have some sense of statistical, assurance when we start to see differences and trends over time. And so it's not every sample, but it is a subset of samples that we're sending over, and we're working to increase the number of samples that we're sending, just to make sure as we're moving into the winter months and as we move forward into next year, we have a strong surveillance system here locally so we can detect when there are new variants arising. As you heard described earlier, the timeline for the sequencing is a little bit longer than the diagnosis test. And so it does take time and there's cost associated with it. And very often by the time the sequencing is done, the person's recovered. And so there's very little clinical implications for knowing which variant you have among the variants that we.
So the only thing I'll add to that is the diagnostic test that everybody gets when they go to wherever to get tested, tests for any of it. It just tests for COVID. So there's not a specific test that you're going to ask for to make sure you don't have Delta or to make sure you don't have Omicron. It's that tests for COVID, period. And then the sequencing is what tells us what varieties we have in the community.
Floor is open for follow-up questions. Any further questions today? Thank you, everyone, for your time.
Oh, actually, I have a super quick question. And